Hello everyone, welcome back. We're talking about the development of ear. In this section, we'll deal with the tympanic membrane. Tympanic membrane is what separates the external ear from the middle ear. We'll see how the development of the tympanic membrane proceeds. Then we'll move on to the clinical correlates of the tympanic membrane, and then we'll see the congenital anomalies of the ear itself. So, referring to the figure, this is the ectodermal outer layer, this in blue. This is actually the ectoderm of the pharyngeal pouch. This is the tubotympanic recess in pink. And this in green is actually the tympanic membrane. Now let's see how the development of tympanic membrane proceeds. So there's apposition of the tubotympanic recess in pink. This is the tubotympanic recess. If I represent it with my left hand, and the first pharyngeal cleft with my right hand, there's apposition between the two of them. That is from the first pharyngeal membrane. This apposition results in the formation of the tympanic membrane. So referring to the figure again, this is the in pink is the tubotympanic recess, and this in blue is the first pharyngeal cleft. That is the first pharyngeal membrane, and this in green in between is the tympanic membrane. So the tympanic membrane consists of three layers. The first layer is the outer cuticular layer, which is derived from the ectodermal lining of the first pharyngeal cleft. So first of all, we are talking about the ectodermal outer layer in blue. Here you can see this is the ectodermal outer layer and is composed of the ectodermal lining of the first pharyngeal cleft. Obviously, it makes sense because this is the layer that is forming the outer membrane. Then we have an inner endodermal layer. Here in pink, this is the inner endodermal layer. It is derived from the endodermal lining of the first pharyngeal pouch. So again, it makes sense because this is the inner layer and is being formed by the tubotympanic recess. Now the intermediate fibrous layer, this is in green, is the intermediate fibrous layer. It is derived from the mesoderm, which intervenes between the first pharyngeal cleft and the first pharyngeal pouch. So this is how the tympanic membrane is formed, by an ectodermal component and an endodermal component and a mesodermal component in between. So the tympanic membrane, which separates the external ear from the middle ear, has an ectodermal component which is formed by the pharyngeal, which is formed by the ectoderm of the pharyngeal arch. Then it has a endodermal portion which is formed by the first pharyngeal pouch, and then it has a mesodermal layer which is formed by the mesoderm intervening between the pharyngeal cleft and the pharyngeal pouch. So moving on, let's look at the clinical correlations. The congenital anomalies of external ear. Let's talk about the congenital anomalies of the external ear. So the ear is most sensitive to teratogens during the 4th to 9th week of gestation. So it's a period of a susceptibility for the ear, and any teratogen might act on the developing fetus during this period. So we have anoxia. Anoxia is absence of ear. Whenever there's a before something, it usually means absence. In the figure you can see there's no ear or the absence of ear. So anoxia means absence of the auricle, that is the external ear. The middle and the inner ear components might be present. It's due to the failure of the mesenchymal proliferation to form the auricular hillocks. So the auricular hillocks, which were 6 in number and responsible for the production of external ear auricle, they do not form. It is associated with first arch syndrome usually. So we can also have preauricular appendages and pits. In the figure you can see this is a preauricular pit. So let's see what that is. These are skin tags and shallow depressions. The preauricular appendage, it occurs due to development of an accessory hillock. So if there's an accessory hillock, we can have a preauricular appendage. Now, preauricular pits occur due to abnormal development of the auricular hillocks. So there are two things going on at this in this condition, we can have accessory hillocks. Accessory hillocks will give rise to preauricular appendages. However, if a person has preauricular pits, there's abnormal development of the hillocks, not supernumerary hillocks. So moving on, we can also have atresia of the external auditory meatus. So we talked about the development of the external auditory meatus before. The external auditory meatus develops from the ectoderm of the first pouch. So the ectoderm of the first pouch is responsible for the formation of a solid plug. This solid plug undergoes canalization just before birth to form the external auditory meatus. However, if this canalization does not take place, the meatal plug remains, and this is responsible for the atresia of external auditory meatus. So there's failure of the meatal plug to canalize. As a result, it presents as conduction deafness and is often associated with first arch syndrome, as can be seen in the figure. So this was all about this section. In this section, we talked about the development of the tympanic membrane. The tympanic membrane has an ectodermal component, has a mesodermal component, and an endodermal component. The tympanic membrane is responsible for separation of external ear from the middle ear. Then we moved on to congenital anomalies of the ear. We saw the period of greater susceptibility to ear development, and then we talked about the congenital anomalies as to what happens when things go wrong. I hope you enjoyed this section. For further sections, keep watching sqadia.com.